Alright, we're going to talk about diabetes because it is becoming increasingly prevalent in our society today, and in most cases it is preventable. So with this video, we hope that you leave with a better understanding of what diabetes is, how it can be prevented, and some ways that it is managed. So diabetes mellitus is a metabolic disease in which insulin is not efficiently distributing glucose, which is commonly known as blood sugar, in the body, and results in high levels of glucose circulating in the bloodstream. This can be caused by a number of factors, including insulin resistance or a malfunction in insulin production. The hormone insulin is produced in the pancreas, and then that insulin is used to transport glucose from circulating blood into various cells, like fat, muscle, and liver, which are then used for energy. But when these cells are no longer able to effectively pull in glucose using insulin, it's known as insulin resistance, which is commonly seen in type 2 diabetes. And then with type 1 diabetes, it's usually because there's not enough insulin produced. We're going to talk for a little bit about different types of diabetes. So type 1 diabetes is an autoimmune disease, which means that the body's own immune system attacks the insulin-producing cells, which leaves the pancreas unable to produce adequate amounts of insulin. Because the body can't produce enough insulin on its own, individuals with type 1 diabetes require doses of artificial insulin in order to maintain normal blood sugar levels. Type 1 diabetes can be diagnosed at any age, but is sometimes still referred to as juvenile diabetes because it's typically diagnosed at a younger age than type 2 diabetes, although recent trends are slowly changing this generalization. Type 2 diabetes is the most common form of diabetes. It's estimated that up to 95% of all diagnosed Americans have type 2 diabetes. There are many factors that contribute to diabetes, including insulin resistance, as mentioned earlier. These individuals are not able to produce enough insulin to make up for the resistant cells, and this leads to unbalanced blood sugar. Type 2 diabetes typically has a gradual onset, and an individual can be undiagnosed for years because of this. It's estimated that about 1/3 of all diabetics are not yet diagnosed and don't even know that they have diabetes. There is a genetic link, so an individual is at a greater risk if an immediate family member has diabetes. Being overweight or obese and a lack of physical activity are also major risk factors and contributors to developing type 2 diabetes, which we'll talk about a little bit more later. And type 2 diabetes is more commonly found in middle-aged adults and has been referred to as adult onset diabetes, although it has recently increased in incidences in younger adults and children, which could be due to the fact that childhood obesity has been on the rise. Some other forms of diabetes are gestational diabetes, which is only seen during pregnancy and is caused by insulin resistance as a result of the increase in pregnancy hormones and weight gain. There's an increased risk for the mother with gestational diabetes and her infant to develop type 2 diabetes later in life. Latent autoimmune diabetes in adults is similar to type 1 diabetes, but typically diagnosed after 30 years old, and is thought of as a slow developing type 1 diabetes. Maturity onset diabetes of the young and neonatal diabetes mellitus are thought to be caused by a genetic mutation and are much more rare. It's really important to be aware of diabetes and your own health because diabetes that is left undiagnosed or untreated can lead to detrimental health defects and is the #1 cause of kidney failure, limb amputation, and new onset blindness. So the most effective thing that you can do to prevent diabetes is simply to have a healthier lifestyle overall. Now, when I say simply, I know that it's not easy to change habits, but that making small changes can help a great deal to improve your health. So switch things up and find a form of exercise that you enjoy and commit to being active. Remember that any form of physical activity is better than being inactive all day. And having an exercise partner will help you be more regular about your exercise if you need additional motivation. Eating healthier foods and smaller quantities will also help get rid of excess weight that could otherwise lead to diabetes. And if it helps, use the things that you learn here as motivation to change your habits, because I'm sure that you don't want diabetes or other diseases that can often be avoided through healthy living. So we're going to talk a little bit about signs and symptoms of high and low blood sugar for those who do have diabetes. So low blood sugar, known as hypoglycemia, is characterized by shakiness, nervousness or anxiety, sweating, chills, and clamminess, irritability, confusion, fast heartbeat, kind of like mine right now, and lightheadedness or dizziness. And then if you see these signs and symptoms, then you will want to get in some additional sugar. So have some orange juice, eat a piece of candy, or diabetics will often have glucose tablets. So you can remember hypoglycemia and what to do with it by the jingle, "Cold and clammy, eat some candy." Hyperglycemia, or high blood sugar, is shown by frequent urination, increased thirst, blurry vision, sores that won't heal, fatigue, and difficulty concentrating. So you can remember this by hot and dry, sugar is high. So what you'll want to do with this is administer insulin if it's prescribed, and then cut back on food consumption to help keep it better regulated over time. And then exercise will also help decrease blood sugar. And then if you find that you're consistently high with your blood sugar, you might want to evaluate your treatment plan with your doctor. Long-term management goals are highly recommended to control blood sugar. They can decrease the risk of additional complications such as limb amputation and blindness, and can possibly even result in complete recovery. But that's only with type 2 diabetes. To manage diabetes mellitus, some things you can do are to start getting into a routine of walking, building muscles through exercise, participating in yoga to reduce stress, and maintaining a diet with lots of fiber and small amounts of sodium will help you feel better. And one of the most important things is getting enough sleep, because when you are sleep deprived, it can cause uncontrolled blood sugar spikes. There are many programs and other resources available to people who have diabetes. So if you have diabetes or are at risk, I encourage you to look for resources in your area, and just a quick Google search will likely result in many different options to you. You may also find exercise and nutrition support, which are essential to the management of diabetes. So here we have just one example of a local program. It's in Gilbert, Arizona at the Mercy Gilbert Medical Center, and they have a couple different groups that meet. The first is for children's diabetes education and support. So it's meant for kids with either type 1 or type 2 diabetes or who are pre-diabetics. And they offer meetings with a certified instructor who teaches them how to begin insulin treatment and how to regulate it over time, how to work and care for insulin pumps, and they also offer nutritional education. A Sweet Life is a diabetes outreach connection group which is led by diabetes educators, and they also have guest speaker who will talk about a variety of topics that relate to issues diabetics may be faced with through the course of their disease. Pumpers Group is for diabetics who have insulin pumps or who are considering getting one, and it works as a discussion forum where people talk about what's worked for them and different things about the pump. And then they also have weekly classes for patients with gestational diabetes. In the past, diabetics have faced unfairness in the workplace. Today, hopefully that is gone, because diabetes is now considered a disability in the workplace, so employers are legally obligated to make accommodations for diabetic employees for activities such as checking blood sugar, taking a snack break, and anything else that may be necessary to manage their condition. African Americans, Mexicans, American Indians, Hawaiians, and Asian Americans have a higher risk for diabetes type 2. So if you fall into these demographics, we recommend checking out your other risk factors and possibly even getting your blood sugar tested to see if it is high. Diabetic medications are not cheap, and Obamacare has provided the opportunity for many diabetics to be able to afford medications and supplies to assist them in controlling their blood sugar. An important step in managing your diabetes is making changes in your personal life to improve your health. So create a pattern of regulation and integrate it into your lifestyle. Know your limits and your capabilities, and don't hesitate to ask questions. Thanks for watching.